Hey there, Heather, pelvic health therapist at Mend Physical Therapy, just dispelling a little bit of fear around pelvic floor dry needling. Yes, pelvic floor dry needling. A really cool tool. I'll kind of show you some spots we typically hit. First thing to talk about is nothing is ever entering rectal or vaginal canal. These are external techniques, though they often involve someone being undressed, and sometimes they involve a backdrop of a finger that is inserted vaginally or rectally. Now, I will say these are not painful spots. If you've ever had dry needling before, where you've had it probably was more painful than some of these pelvic floor spots. So they're not too painful. We don't often use stim, and we don't often use a pistoning technique with these, as they are a little more sensitive. Needle in, needle out. So here's where we often target. This ischiocavernosus muscle. We'll kind of go directly into that muscle with needle. Imagine this pen is needle. Oftentimes this bulbospongiosus muscle will kind of needle right along that, often with one finger vaginally. We can target this superficial transverse perineal muscle. Again, needle kind of going right in, often with a finger backdrop. Some fun ones we can do on the posterior pelvic floor in lying on your side position, usually often with one finger rectally. We can target coccygeus muscle. One of my all-time favorites, we can target puborectalis muscle, which can really help decrease any tension and tone in that muscle. And again, often finger is inserted rectally and the needle's coming down this way. Another muscle we can hit, a really fun one called the obturator internus muscle. And this is also lying on your side. Our needle is often coming down this way into pelvic floor. All of these have amazing benefit for a tight or hypertonic pelvic floor. And while this is a female anatomy model, we also do this on male pelvic patients.